Well, hello there. It's Dr. Jim. Good to see you. Thank you for stopping by for your very first time or coming back for your upteenth time. The more the better. I have a good topic. This topic is derived from my passion for studying neurodegenerative disorders as a gerontologist, and it comes from my passion for learning about and understanding the potential of CBD as a treatment. I wrote a whole book, Living Longer and Stronger with CBD. I studied, read, digested 500 to 600 medical studies and summarized them in this book. One of the chapters in this book is on neurodegenerative conditions: Alzheimer's, Parkinson's, Huntington's, multiple sclerosis, and one of the most dreadful ones of all, amyotrophic lateral sclerosis, or ALS. That's what I want to talk about in today's episode, CBD and ALS. And I'd like to give you some research findings. So if you're 50 or older, you may remember the Jerry Lewis Labor MDA Telethon, Muscular Dystrophy Association. I'm showing my age. I'm a little over 50. It was televised every single year, and I remember staying up all night because I liked Jerry Lewis. He was funny. But he raised money. He sang some songs. He was in a tuxedo. He changed his suits all day and all night. He was smoking cigarettes during the telethon. And I thought, that's pretty damn cool. What I didn't realize at the time was that the MDA, Muscular Dystrophy Association, was responsible for not only research in muscular dystrophy, but in ALS as well. I didn't know that. Did you? So what is ALS? Very quickly, it's a fatal neurodegenerative disease caused by the selective and progressive injury and death of motor neurons that are located in the spinal cord, the brainstem, and the motor cortex. When cells in those regions die, the individual loses voluntary muscle control and movement, making chewing, speaking, and walking difficult to absolutely impossible. Once the nerve dies, it can no longer send signals to muscles, which cause those muscles to twitch, spasm, become progressively weak over time, and unfortunately eventually waste away. Once the disease begins, it almost always progresses, and it shortens lifespan dramatically. These folks die way earlier than they normally would without it. Despite this, the progression is not always a straight line, meaning that there are periods of arrest, and within these, people have seen little to no loss of function for maybe a few days, a few weeks, and sometimes a couple months or a few months. What causes this deadly, terrible disease? While it's not clear exactly what causes ALS, we do know that there are at least two different forms of the disease. One is called sporadic. Sporadic ALS has no known etiology, cause, or origin, and accounts for about 90% of cases. The other form is called familial, which means genetic, and this represents anywhere between 5 to 10% of cases. What's interesting is this. It appears that athletes and people who have served in the military have a higher risk of developing ALS, and the United States Department of Affairs has recognized ALS as a service-connected disease. I didn't know that. 2 specific groups of military personnel have shown a higher incidence of ALS. Those who served in Guam in the late 1950s, and recently those serving or did serve in the Gulf War. There's now ongoing research investigating exposure to neurotoxins as the potential cause of ALS. Symptoms. The symptoms of ALS include progressive weakening of muscles, slurred speech, abnormal fatigue, specifically in the arms and legs, uncontrollable periods of laughing, yawning, or crying, and you may have seen a TV commercial about that. The condition is called pseudobulbar effect, and there are now medications for that. Individuals may also experience problems with coordination, muscle spasms, pain, excessive drooling, mild cognitive impairment, severe constipation, shortness of breath, and severe unintentional weight loss. Those are all really incredibly difficult symptoms to live with. Everything tastes better out of a David Bowie mug. Research findings. This is what you came for. Research examining the effects of CBD for symptoms of ALS have shown, thankfully, mostly positive results. While CBD does not cure the disease, CBD cures nothing. It can help manage symptoms and improve quality of life. Here's some general findings. CBD has been found to ease pain due to its analgesic properties. It helps to reduce muscle tension and induces overall relaxation. It acts as a bronchodilator, opening airways so that people with ALS can breathe easier. It has shown the ability to reduce slow the overproduction of saliva, which leads to drooling. It also stimulates the appetite, enhances diet, and improves sleep. Okay? So there was some early research going back to 2007 that I found. CBD has anti-inflammatory actions and actually delayed the progression of neuroinflammation caused by ALS. That's absolutely amazing. Now, the endocannabinoid system plays a significant role. CBD goes into the body, it interacts with the endocannabinoid system, and those magical molecules do some pretty impressive work in that system. So, researchers have discovered the natural ability of the endocannabinoid system to reduce symptoms of ALS, as well as the ability of cannabinoids to alleviate limb spasticity and neurodegeneration. That is absolutely amazing. I've also seen research where ALS medications, other types of medications, and CBD are all combined together. These studies report that a combination of ALS meds and CBD together in combination can improve symptoms and bring some functioning back for the individual dealing with multiple symptoms. It's also believed that CBD is a natural fit in treating any motor neuron disease, including ALS. According to research, it's well tolerated, even at very high doses. For instance, you and I might take 25 milligrams a day, 50, 100 milligrams. These individuals might take 300, 400, 500 milligrams a day, and it's still well tolerated. That is amazing. Here are my final thoughts. Amyotrophic lateral sclerosis, or ALS, is one of the most, if not the most devastating neurodegenerative disorder known. We don't know what causes it. There is no cure, but it's a progressive disease, and it ends up in 100% complete disability. While there are medications and other treatments to help manage symptoms, here's my hope. Perhaps more research will find that CBD and other cannabinoids, either on their own or in combination with ALS medications, will delay the disease, greatly improve symptoms, or slow the progression and improve the quality of life for these individuals who are really suffering. Thank you so much for your time. This has been CBD and amyotrophic lateral sclerosis, some research findings. And again, I know I wrote the book, I'm proud of it, but check it out, Amazon.com. It's a great read. And if you're curious about CBD and a lot of physical, mental, emotional, neurological disorders, this is the book for you. I'll see you soon.